Good morning. It's 4:31. Let's start. After finish, I haven't made a plan. So let's plan together. Advance. I'm Manish, Nishtha, Abhay, Sanya, Manisha, Riya, Aditi, Moana. Start. Please drink water also. Having water is important. Hi Shruti. My hair is all messed up today. Because it's long. So in the morning, there's no time on it. Usually I don't do anything because like it's usually that way. Yes. Agreed. But welcome back, Shruti. Good morning, Aditi. Hi, Mona. So you can put your goals in the chat. We will. I might have to go for a bit for Gudi Padwa Niche. We have a function in the building, but more or less, yeah, full day. I don't know, but how much of a time I can, we'll try. Yes, we can keep a long day. For sure, we can have a long day of studying. Sure, I'll just plan. Let's make a realistic plan. Kaise ho? Mast. Good. How are y'all? How are y'all doing? All good? Any problems, difficulties? Okay, so till 5 o'clock, we'll finish circulatory shock. I just want to do biochem. I want to finish biochem like A to Z. What problems, Ansh? ओ हाँ वो GFR भी करना है ब्रेक वीक में आई डू GFR क्रेनियल हम निपटा लेते हैं तो क्या Lineage just needs to be overcome. That's it. 720 to 8. Constant. Break it. You'll sleep at 6. My god. Hell yeah. You're breaking at 6, you're sleeping at 6. It's okay. Just make sure you sleep enough. Hi, Sheikh. Oh, nice. Yeah, yeah, Aditi, go rest. Good morning, Radha. Mm, till 9, we'll do cranial, and then probably full day, we'll do protein metabolism. Did you sleep during power nap? Matlab? Huh. I mean, that is the point of power nap. Oh, you got some bad infection. Oh, take care. All the best also for your FST. Hope it's in your like non-dominant hand, the infection. Oh, damn. Now 9 to 9 we have full biochem protein metabolism. We're gonna do entire cranial. I'll just be back in like 3 4 minutes. I'm taking a power nap. I'll come back in like 5 10 minutes. Anaphylactic and histaminic shock. Anaphylaxis is an allergic reaction in which the cardiac output and the arterial pressure often decrease drastically. Uh, Cardiac output and the arterial pressure often decrease drastically. It results primarily from an antigen-antibody reaction that rapidly occurs after an antigen to which a person is sensitive enters the circulation. Principal effects is to cause the basophils and mast cells in the periphery to release histamine or histamine-like substance. It causes an increase in the vascular capability because of venous dilation. Increase in the vascular capability due to venous basophils. Basophils and the mast cells in the pericardial tissues to release histamine or a histamine-like substance. The histamine causes an increase in vascular capacity because of venous dilation and a marked increase in the venous return. Dilation of the arterioles results in greatly reduced arterial pressure, greatly increased capillary permeability, rapid loss of fluid and protein into the tissue spaces, and effective the great reduction of the venous return, and sometimes serious shock that the person may die within minutes. Intravenous injection of large amount of histamine causes histamine shock, which has characteristics almost identical to that of anaphylactic shock. So, mm, they're releasing histamine or histamine-like substance, which will cause venous dilation, reduced arterial blood pressure, capillary permeability increase, rapid loss of fluid and protein, and reduction in venous return. These are all part constituting anaphylactic shock. Now coming to septic shock. Mm, Septic shock refers to a bacterial infection widely disseminated to many areas of the body, with the infection being borne through the blood from one tissue to another and causing extensive damage. There are many varieties of septic shock because of the many types of bacterial infection that cause it. Many varieties because of the many types of bacterial infections that cause it. Because infections in different parts of the body produces different effects. Most cases of septic shock are caused by gram-positive bacteria, followed by endotoxin-producing gram-negative bacteria. Oh, so one is by gram-positive bacteria, followed by gram-negative for endotoxin-producing gram-negative bacteria, which is present in the intestine when they're dead. Septic shock is extremely important in the relation because other than the cardiogenic shock, septic shock is the most frequent cause of shock-related death. Other than cardiogenic shock, there's septic shock, which is the most frequent cause of shock-related death. Septic shock after cardiogenic shock, irreversible shock. So the typical causes of septic shock from the following include peritonitis caused by spread of infection from the uterus and the fallopian tube, sometimes resulting from instrumental abortion performed under unsterile conditions. It's caused spread of infection from the uterus and fallopian tubes. Infection from uterus and fallopian tube sometimes resulting from instrumental abortion performed under unsterile. This is called peritonitis. Peritonitis may infection in the fallopian tube and uterus. Infection in the fallopian tube and uterus due to abortion. Fallopian tube and uterus. Peritonitis resulting from rupture of gastrointestinal system. So rupture of GIT, infection of the GIT, uterus and fallopian tube. Rupture, infection of uterus and fallopian tube. And the rupture of the gastrointestinal system caused by intestinal disease and sometimes by wounds. Hmm. Rupture of gastrointestinal system. Generalized bodily infections resulting from spread of skin infections such as streptococcal or staphylococcal infection. Generalized bodily infection resulting from the spread of a skin infection like streptococcal or staphylococcal infection. That is body infection होगा. Guys, gangrenous infection resulting specifically from the gas gangrene bacilli. Peripheral tissue say it goes to liver. So there's gangrenous infection from peripheral tissues to liver. There's bodily infection due to streptococcal or staphylococcal. Peritonitis caused by infection of uterus and fallopian tubes. Infection spreading into the blood from the kidney or urinary tract, often caused by colon bacteria. So blood say kidney, blood from the kidney or urinary tract by colon bacteria. Special features of multiple types of septic difficult to categorize the condition. High fever, often marked vasodilation throughout the body. In the infected tissues, you have severe vasodilation. You also have marked vasodilation and high fever and marked vasodilation. High fever and marked vasodilation. Then we have high cardiac output, perhaps half of the patient, caused by arteriolar dilation in the infected tissues and by high metabolic rate and vasodilation elsewhere in the body. So we have a high cardiac output in the first half of the patient. So there's arteriolar dilation in the affected tissues. There is a high cardiac output, arteriolar dilation, and by high metabolic rate and vasodilation elsewhere in the body resulting from bacterial toxin stimulation of cellular metabolism and high body temperature. There's a higher cardiac output. Mm, mm, Caused by arterial dilation, high cardiac output, high metabolic rate, and vasodilation. Sludging of the blood caused by red cell agglutination in response to degenerating tissues. Development of micro blood clots in widespread areas of the body. It causes and it's called disseminated intravascular coagulation, DIC, disseminated intravascular coagulation. The, the blood clotting factors to be used up. Blood clotting factors are used up. Hemorrhage occurs. Oh, gut wall. So that's called septic shock. Septic shock. Peritonitis, disseminated intravascular coagulation. This causes blood clotting factors to be used up, so hemorrhage occurs in many tissues, especially in the gut wall of the intestinal tract. Gut wall of intestinal tract. In early stages of septic shock, the patient usually does not have signs of circulatory collapse. Disseminated intravascular coagulation, because hemorrhage occurs in the gut wall of the intestinal tract. In early stages of septic shock, the patient usually does not have signs of. So septic shock में क्या होता है? In early stages, the patient does not have septic shock, but only signs of bacterial infection. As the infection becomes more severe, the circulatory system becomes more involved, either because of direct extension of the infection or secondary as a result of toxins from the bacteria. Push, push. As the infection becomes more, the system becomes involved. Then finally comes a point when the deterioration of the circulation becomes progressive in the same way. Deterioration of the circulation becomes progressive in the same way that progression occurs in all other types of shock. The end stages of septic shock are not completely different from the end stages of hemorrhagic shock. Physiology of treatment in shock replacement therapy. So now what is the treatment? One is replacement therapy, blood and plasma transfusion. Then second is dextrin solution. Third is treatment of neuro and anaphylactic shock with sympathomimetic drugs, oxygen therapy, head down position, glucocorticoid. So one is something called as replacement therapy. Blood and plasma transfusion is a person shock caused by hemorrhage. The best possible therapy is transfusion of whole blood. The if the shock is caused by plasma loss, best therapy is administration of plasma. And dehydration is the cause of electrolyte. For dehydration, electrolyte. For transfusion of whole blood, then whole blood if it's hemorrhage. If it's loss of plasma, then you do plasma. If it's dehydration, then you do electrolyte solution. Whole blood is not always available, such as under battlefield conditions. Plasma can usually substitute adequately for whole blood where increase the blood volume and restores normal hemodynamics. Plasma cannot restore normal hematocrit. Therefore, in emergency conditions, it is reasonable to use plasma in place of whole blood for the treatment of hemorrhagic or most other types of hypovolemic shock. So, plasma instead of whole blood for the treatment of hemorrhagic or other types of hypovolemic shock can be used. Sometimes plasma performs exactly the same human-like function as plasma. This is dextrin solution. As a plasma, one of the requirement of a truly effective plasma substitute that remains in the circulatory system that does not filter through the capillary pores into the tissue spaces. Must be non-toxic. Appropriate electrolytes to prevent derangement of body's accelerating some substances that has large enough molecular size. Treatment of neurogenic and anaphylactic shock with sympathomimetic drugs. That is treatment of neurogenic and anaphylactic shock with sympathomimetic drugs. A sympathomimetic drug is a drug that mimics sympathetic stimulation. These drugs include mimic sympathetic stimulation. Sympathomimetic drug, epinephrine, norepinephrine, large number of long-acting drugs. The same basic effect is epinephrine or epinephrine. In the two types of shock, sympathetic mimetic drugs have been proved to be especially beneficial. The first of these is neurogenic shock, in which the sympathetic nervous system is severely depressed. Administering a sympathomimetic drug of the takes the place of the diminished sympathetic action and can often restore full circulatory function. So it can restore the full circulatory function. The second type of shock in which sympathetic nervous system is anaphylactic shock. Anaphylactic shock and neurogenic shock may this is applicable in which access histamine plays a prominent role. The sympathetic nervous drugs have a vasoconstrictor effect that opposes the vasodilating effect of histamine. Therefore, norepinephrine, epinephrine, or other sympathomimetic drugs are often life-saving. Sympathomimetic drugs have not proved to be very valuable in hemorrhagic shock. falls too low in most types of shock, especially in hemorrhagic and neurogenic shock. Patient with its head at least 12 inches lower than the feet. So जो feet है उसके 12 inches lower में head है helps in promoting venous return, thereby also increasing the cardiac output. The head on position is one of the essential step in treatment of many types of shock oxygen therapy because a major deleterious effect of most types of shock is too little delivery of oxygen to the tissues. One of the effects is too little delivery of oxygen. Giving the patient oxygen to breathe can be a benefit in some cases. However, this intervention is frequently far less beneficial than one might expect. The problem most of shock is not inadequate oxygenation by the lung, but inadequate transport of the blood after it is oxygenated. Treatment glucocorticoids, adrenal cortical hormones, control glucose mechanism, frequently conservation, explanation, impaired glucocorticoids frequently increases strength of the heart rate. In the later stages of shock, they stabilize lysosomes in the tissue cells and thereby prevent the release of lysosomal enzymes into cytoplasm, thus preventing deterioration. So they increase the strength of the heart, stabilize lysosomes, and they might aid in the metabolism of glucose by severely damaged cells. So जो भी severely damaged cells है उनको it will aid to do metabolic metabolism of glucose. Now coming to circulatory arrest, the condition closely allied to circulatory shock is circulatory arrest, in which all the blood flow stops. Circulatory arrest मतलब कुछ हो ही नहीं रहा. Shock is circulatory, all blood flow stops. This condition can occur, for example, as a result of cardiac arrest or ventricular fibrillation. Cardiac arrest or ventricular fibrillation, in all the blood flows only stopping, no blood flows left only. No blood flow, all blood flow is stopped. So all blood flow stops, and this is called as cardiac arrest or ventricular fibrillation. Cardiac arrest and ventricular fibrillation, in which all the blood flow is essentially stopping. All blood flow stops in cardiac arrest and ventricular fibrillation. This is called circulatory arrest. Ventricular fibrillation can be usually stopped by strong electroshock of the heart, the basic principles of which are described in 34. In case of a cardiac arrest, a normal cardiac rhythm can be restored by immediately applying cardiopulmonary resuscitation procedures, at the same time supplying the patient's lung with adequate amounts of ventilatory oxygen. Effect of circulatory arrest on the brain. A special challenge in the circulatory arrest is to prevent detrimental effects of circulatory arrest in the brain. In general, more than 5 to 8 minutes of total circulatory arrest can cause at least some degree of permanent brain damage. More than 5 to 8 minutes of total circulatory arrest can cause at least some degree of permanent brain damage in more than half of the patients. Circulatory arrest for long as 10 to 15 minutes almost permanently destroys significant amounts of mental power. For many years, it was thought that if blood clots are prevented from occurring in the blood vessels of the brain, it will also prevent much of the early deterioration of the brain during circulatory arrest. For instance, in animal experiments, all the blood was removed from the animal's blood vessels at the beginning of the circulatory arrest. The brain was attention sympathetic nervous system, heart, blood vessels, and kidney. Kidney releases angiotensin. Angiotensin releases aldosterone. Aldosterone increases sodium water retention that causes more cardiac output. There's restoration of tissue perfusion. Definite circulatory shock. Oh, guys, it's 6 o'clock. You can take a break. If you wanna ask anything, you wanna discuss. Aditya, you sleep enough. Oh, good, good. You train mixed martial arts. Oh, yeah, I can see by your DP. Damn. Very nice. Hi, Pratik. Good morning. I make a lot of silly mistakes, Moana, in bio. How to stop? Silly mistakes are often just in our mind. Like, if we go with the complete mental thinking, I won't make silly mistakes. You go with a right mindset by meditating. Usually nahi honge silly mistakes is what I've seen. It's all mental only, like mental game. Silly mistakes and all, I feel. My learning from whatever competitive exams I've given. I feel Hi Shubham. Bye Aditya. Target hit. Oh great, Addy. Good job. Can you, Ria, can you tell me a sequence in which you attended a test? Uh, I did BCP. I feel that's the best. Bio has to be done first. Yes, correct. Grab marks first. Correct. Honestly, I what I did is I used to mark after every question. I found that more effective because it prevents it's fresh in your mind. And if you're not sure, just leave the question. But if you mark all later on at one time, that can be risky. Like if you mismark, then that can go really wrong. I score better in physics than in chem. Should I do BPC? हाँ चलेगा. Whatever you get more marks in. Usually chem में what is the thing ना कि chem में either you know it or you don't know it. So chem में see even if your physics you score better, but chem में mostly it's very objective based. So it's easy to grab marks which you know. Physics में you have to actually take time and solve it. So chem में say even if you're scoring more in physics, but chem में out of 45 you're able to do 30 questions properly. Right, if you then do those 30 questions properly, those 15 questions which are not able to do, come back later, finish physics and come back. But I feel always BCP would be better because chem is just grabbing marks. Happy Gudi Padwa, yes. I get really tired around 2 hours mark into the paper. And don't do questions that I know how to. Hmm. Yeah. So what I used to do after, say I finish bio, I take 1 hour. I used to put my head down, finish bio, and that shloka I used to say. Then after bio for 10 seconds I should take a break, say the shloka. Alpashodam Shudhatam Parihasamatul Bhaktire Mukhari Gute Pranam Yetu Kila Kila Madhamaduram Yoti Tacham Charu Klikani Kareke Hetu. Put my head down, freshen up, take a deep breath, and be like, I'm gonna ace chemistry or I'm gonna do really well in chemistry. Start chemistry. It immediately gives you a bout of energy. Then when my chemistry is done, again put my head down, give myself a 10-second break, be like, okay, now physics, I'm gonna go head on, then start physics. That's what really works. So you prevent fatigue also. And in the middle also, if I'm solving bio and I'm getting very stressed or tensed, usually nahi hota tha, I used to not get stressed. But I should just sit with my head, okay, it's fine. It's okay to take a break for 10-20 seconds in the middle, like be like, calm down, you're gonna do it, you know your stuff, just go head on. Just talk to yourself for like 2-3 times. Happy Gudi Padwa. How do you meditate? कुछ नहीं, close your eyes, say your shloks, manifest. बस. No, Rida, don't use whiteners. In my coaching, they used to be strictly not allowed. There's no point of whiteners, no. You're creating a wrong system in your mind. You'll always feel like I can come back to it and change my answer, but that has no use, no, because NEET may not allowed anything. How can you take 10 minutes nap? You feel more sick. Okay, see, it's not like I said, whatever works for me may not work for you or work for everyone. So if it doesn't work for you, don't. But I always just feel more energized when I take it. The immediately marking I always feel is better because later on, if you mark in a bunch, it is risky more than anything. Like you can't go wrong marking one question. Of course, if you're not confident, don't mark it that time. If you're 100% confident, then mark it that time. Whatever you're not confident, mark it in the paper and question paper and keep. But if you mark all questions at once, that is very risky. Like say you miss a question, you go rest. That can really be very harmful if you like miss a question and then rest. Everything will go. I'm Malik. सो जा. अभी मैं सो के आया. पावर नैप. 70 mark bio question. नाश्ता कर ले. नहीं सर, नशा कर रहा है ब्रो. नाश्ता कर रहा है. आजकल मौलिक जल्दी उठ रहा है. And I do take that day also Molly got up at 6. I do take 2 3 minutes break after solving. हाँ good. 2 3 minutes maybe थोड़ा decrease करो maybe 1 minute 30 seconds. कितना पड़ेगा भाई, सो जा. फ्रूट्स के नशे. यस. I'm on a grape streak. Also, I eat dahi like just like that. It's so healthy. Like yesterday on stream, I finished an entire like bowl of just dahi. I eat just plain dahi. It's so nutritious and so healthy. भाई कुछ भी ऐसे ही बोला. I don't, I genuinely don't. Grapes are the हाँ, that's why I like things which are easy to eat. मालिक भाई तो खुद की बात कर रहा है. Still no secret, no, it's fake. He's just lying. I swear, he's lying. Malik also knows that. If my girlfriend is Guyton, then for sure, yes. I agree, Malik. What's your opinion on alternating papers? It kind of breaks the link though. I went on a walk, it felt so nice. My dog accompanied. Oh, nice. And sleeps after saying Zanmet to sleep. Bye, Manisha. All the best. Thing with me is I don't like paneer, but milk products, dahi. Do you don't like to work out? No, I won't. I like working out. I'm just lazy. I'll work on it though. I'm sure I will. And once I start, then I won't. Then no one can stop me. Like once I start, like when I start something, I take very long to start something. But when I start something, then it's much easier to go ahead with it. Like I'm very good at maintaining something, but to like start something takes time. Like even for me to start studying will take time. But once I start studying, then no one can stop me. So, अरे मौलिक भाई. मौलिक भाई तुम जैसे इतना परफेक्ट कोई नहीं यार. या मौलिक भाई वैसे बनते हो. What slope? Wait, I'll send it in the chat. Now you can say whichever shlok you've learned. Like there's sometimes that there's Saraswati Mata called Saraswati Namastubhyam Vade Kamarupani. So my mom used to make me say it before going also for tests. So whatever works, whatever you've grown up learning, but we are fine. So let's start now. यार why is my laptop glitching? Tomorrow is Eid. Oh nice. What are plans, Rida? Yeah, tomorrow is Eid. We have a holiday. Yeah, in between paper has to say the show. 12 hours today, easily, easily more than 12 hours. I'm very confident that आराम से 12 hours तो हो ही जाएंगे. You appeared in a lot of exams, cracked them with amazing ranks. Question 1: how many of them were before NEET? All exam dates are very close to NEET. How you managed all of them when NEET was your main goal? See, most of them was, yeah, it's 12 hours streaming. Most of them were post NEET, huh? Men's, abhay. I think only JE and MHCT was before NEET. That also my mom was so against it. She's like, no, don't give don't give CT. What will you give? What will you get by giving CT? Like it's useless. You'll waste time. You'll waste a day before your NEET. What are you gonna achieve? I'm like, no, no, no. I have to give it. And she's like, why aren't you carrying a pen? Some discussion we had. Then we realized कि नहीं, it's a online exam. It was very funny. Yeah, it's called Bhaktamar Stotra. And then I'm so grateful that I went for JE. My God, for JE, nahi, for CT. My mom, uh, because CT literally no NEET का कुछ भाव नहीं मिला. Like CT only gave all the newspapers and all. Like I think 10 or 11 newspapers contacted, but only for CT, not for NEET. NEET के लिए no one contacted. Like all my newspapers were mainly due to CT, and then once the CT, then they asked about my other achievements. Then they put NEET and all, but no one primarily asked me through NEET because what I realized now, which is kind of sad, is everyone cares about first rank. All in who gets the first rank. No one cares about someone who's got the second rank or someone who's got maybe a great rank but not the first rank, because everyone wants that glamour of first AIR one, this that. So that's why CT may also, like, because I got, though my NEET achievement to me is much more valuable than my CT, just because I worked so hard for it. Of course, that helped in CT also, but to me the NEET rank is more precious. But everyone cares about that one rank one. Exactly, yeah. That's a hard reality. So I realized that everyone ultimately only cares about the first rank. It's sad, but it's the truth. So I was very grateful. Retrospectively, I was very grateful that I gave CT. Like I gained a lot of confidence post CT because of all those newspaper articles and everything. It was always my goal to get an AIR one in an all India exam. I really wanted it for NEET. Like I was craving an AIR one. Like I was like, no way that I have to get an AIR one. I was not overconfident about it. I just wanted it. Like that was my biggest goal. Leave for Sunday test. Bye, bye, MS. All the best. I told my mom about you, and now daily she's like, you have to sleep jaldi subah. Utha, you should see him and you'll get some buddhi. So nice. I'll screenshot that. Nice, sweet. I'm glad. Chalo. That's right. Then I'm going to start biochemistry, and I will do it. I can do it. No matter how many pages, no matter what, I will sit and finish this. Biochem. See, now my biochem is weak. Not weak. I won't say it's weak. It's something I will overcome. I'm not going to use any negative term. My biochem is going to be great, and I will put all my effort for biochem, and I will get it back on track, no matter what. Nothing is impossible. It's just hard work. Hard work can do anything. I just need to sit at it. Let's go. Mechanism of action. During the first step of ubiquitination, even activating the section of ATP, the even can then transfer to ubiquitin to ubiquitin conjugating enzyme E2 in the ATP dependent reaction. ATP dependent reaction. ATP dependent reaction. Ubiquitin. Ubiquitin. ठीक है. Ubiquitin. It is so named because it is seen in all cells abundantly. It's seen in all cells abundantly. It is a small protein with 76 residues. The protein is marked for degradation. Ubiquitin is now linked with E2 conjugating enzymes. There are several different E2 enzymes. That is more than 30 E2 enzymes in humans with the help of a third enzyme, E3 ligase. So there's a third enzyme called E3 ligase. Then that ubiquitin is transferred from the E2 enzyme to the substrate. So E3 ligase के साथ ubiquitin is transferred from the E2 enzyme to the substrate. Ubiquitin is transferred from E2 enzyme to the substrate protein. From E2 enzyme to the substrate protein, resulting in the bond between the substrate and the ubiquitin. Resulting a bond between the substrate and the ubiquitin. Ubiquitin ligation provides the key steps of substrate selection and ubiquitin transfer to the protein target. Key steps of substrate will be selected and the ubiquitin transferred to the protein target, with the E3 ligases being responsible for substrate specificity and regulation of the ubiquitination process. Additional ubiquitin molecules can be linked to the first one to form a polyubiquitous chain by means of a UV elongation enzyme E4. Now proteasomes, ubiquitin attached proteins are immediately broken down. So proteasomes, ubiquitin attached proteins are immediately broken down inside the proteasomes of the cell. Ubiquitin attached proteins are broken down inside the proteasomes of the cell. Proteasomes में ubiquitin attached proteins are detached and broken down. The proteasome assembly has a central cylinder hollow core. Ubiquitin type proteins are taken into the spiral and surrounding proteolytic enzymes digest the proteins into small oligopeptides of 5 to 6 amino acids in length. The 26 proteasomes is a large 26S proteasome is a large more than 60 subunit complex. 26 proteasome is more than a 60 subunit complex with a 20S barrel shaped proteolytic core consisting of an alternating alpha and beta subunits. Alternating alpha and beta subunits. 26S proteasome 26S proteasome is more than 60 subunits. The 26S proteasome is a large, more than 60 subunit complex with a 20S barrel-shaped proteolytic core consisting of alternating alpha-beta subunits. You have alternating alpha and beta subunits, that is 26 proteasome. There are 26 proteasome is a large subunit consisting of 20 shaped barrel cells proteolytic enzyme alternating alpha and beta subunits and two regulatory 19S caps at either end. So there's a 20S barrel-shaped proteolytic core consisting of alternate beta and alpha subunits and two 19S regulatory caps at either end. Two 19S regulatory caps at either end. The 19S caps recognize de-ubiquitination and unfold the target protein before it is pulled through the hollow core of 20S catalytic center where it is broken up into reusable amino acid components. It recognizes de-ubiquitination and unfolds the target protein before it is pulled through the hollow core of the 20S catalytic center where it is broken down to reusable amino acid components. Inappropriate ubiquitin mediated protein degradation has been implicated in a number of pathological conditions, especially neurodegenerative disorders that involve protein aggregation and inclusion body formation, such as Alzheimer's disease, Parkinson's disease, Huntington's disease, and amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis. ALS is amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis, Parkinson's, Huntington's, and Alzheimer's, and amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis is ALS. Amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis. It's called ALS. Amyotrophic lateral sclerosis, Huntington's disease, Parkinson's disease, and where protein misfolding may play a role. So there's protein misfolding which is playing a role. So you have Alzheimer's disease, Parkinson's, Huntington's, and amyotrophic lateral sclerosis where protein misfolding may play a role. Sinchover, Hirschberg, nitrogen balance. The amount of nitrogen excreted each day is mainly in the urine equals the amount consumed mainly as dietary proteins. Nitrogen balance is described in chapter 31. Hence, nitrogen balance will measure the difference between nitrogen balance is measure the difference between the nitrogen intake and nitrogen excretion. A healthy human adult is in nitrogen balance. During active growth and tissue repair after surgery or trauma, the body is in positive balance. Means the amount of intake is more than the loss. Positive nitrogen balance means more intake than the loss since there is active growth and tissue repair. So there's net nitrogen retention for building new tissues. In fever, starvation, and cachexia. Cachexia, fever, and starvation loss of nitrogen is greater than intake, and the individual is negative nitrogen balance. Fever, starvation, and cachexia loss of nitrogen is greater. Fever, starvation, and cachexia. Fever, starvation, and cachexia, there's more nitrogen loss. So let's see what cachexia is. Cachexia. Fever is a complement. Like anorexia is loss of appetite. Cachexia is loss of muscle mass. Where's muscle mass loss? Fine. Loss of nitrogen greater than the intake and the endogenous is negative nitrogen balance. In pregnancy and lactation, when the protein intake is adequate, transfer of ubiquitin from the ubiquitin activating enzyme E1 to ubiquitin conjugating enzyme E2, followed by its transfer onto the target protein X by the ubiquitin ligase E3. So, transfer ubiquitin from ubiquitin activating enzyme E1 to ubiquitin conjugating enzyme E2. So, the ubiquitin activating enzyme E1 to ubiquitin conjugating enzyme E2, followed by transfer onto the target protein X by ubiquitin ligase E3. The proteasome is composed of one barrel and two lids. The ubiquitinated target protein is taken into the proteasome and degraded protein will come out. So ubiquitinated target protein is taken into the proteasome and the degraded products will come out. Green dots are ubiquitin molecules. Yeah. I'll just take a power nap and come. I think I'll end morning stream. I'll sleep for a bit. Maybe then later on I'll restart. Anyways, we'll take that as the evening meet, basically. Take it then. Bye. Not sure actually. Like, we have a Gudi Padwa function also in the building, so I'll attend that. Yeah, I'll just sleep without an alarm. I just wanna. It's a break day, so I'll just sleep whenever I get up. Bye bye. See you all. Work, work. I'll work.